Hi everyone, I'm Dr. Akhila, consultant fertility specialist, Sudha Hospital, Banjara Hills, Hyderabad. Today we are going to talk about diabetes and how it affects fertility. So, diabetes is a chronic metabolic disorder and it affects a lot of organs in the body. And the thing is, because of diabetes, there is a lot of molecular changes that happen. There is hyperglycemia, there is insulin resistance, because of which there is mitochondrial dysfunction, endoplasmic reticulum stress. So every cell is getting affected because of this high sugars. What actually happens at a molecular level is that there is oxidative stress, which means the reactive oxygen molecules they increase in number, so the antioxidant defense mechanism breaks down. It causes inflammation and infection. This is basically what happens when the sugar levels are high. How it affects males is that the hypothalamic pituitary gonadal axis gets disturbed, because of which you can have testicular dysfunction, erectile dysfunction. The sperm quality is lower because of high sugars, and put together the IVF outcome or the embryo quality can be lower. So this is what happens in the males. Now coming to the females, because of high sugars, there can be hormonal disturbances because of which ovulation can get affected, and there can be irregular cycles. Some of them can have scanty period, prolonged period. These are a varied range of irregularities in the menstrual cycle. Apart from this, the egg quality comes down, and we can also expect implantation failures, because of which means that the endometrial lining, the uterus lining can get disturbed. These are all the problems that are there when it comes to diabetes. Now, as I said, it affects almost every other cell, so it causes even neuropathy, which means that there is less libido, and therefore you can have problems with fertility. Now, how to deal with these issues is that number one, control of sugars. We're expecting the HbA1c levels to be less than 6, the fasting sugars to be less than 100, and the post after 2 hours after a meal, the levels to be less than around 120. So these are the expectations that we have. Also, healthy lifestyle, regular exercise, balanced good diet, and if the sugar levels are higher, a diabetic diet. These are all the modifications that you need to make in your lifestyle. Apart from this, we need to have a good strict glycemic control in the form of medicines like metformin and insulin. They're safe in pregnancy, so the sugar levels have to be brought down to normal levels to have a good outcome with fertility. Diabetes does not mean that natural conception is not possible. So natural conception can be possible with a good control, and if treatments are to be done, all the treatments can be done, just that the sugars need to be controlled, and we can proceed for the IVF treatment as well. Any questions, please? 2 years. So, the moment you are conceived, it is very important that we check your HbA1c levels and fasting and your postprandial levels. Should the levels be normal, there is not much of a concern. You can please proceed with the pregnancy, and certain tests need to be done during pregnancy, like NT and NT scan and a double marker and anomaly scan. All these have to be done, and please check what medicines you're taking for sugar control. Some of them are not safe in pregnancy, so that change needs to be done from whatever you're taking, if it's not safe, to something safer like metformin or insulin. Diabetes uh, per se can be controlled with a good lifestyle, and it also is genetic, as in ethnic role is also there. So we as South Asian population are more prone for diabetes, but it is not something that we can definitely say that you're diabetic, your child will definitely be diabetic. There's no genetic testing for the same as well. It is post pregnancy. If you have developed diabetes and you've not had during pregnancy, it just means that there is some hormonal disturbance, and a good diet and exercise and some treatment is definitely indicated. Postpartum depression of late is very common. Please try to get help from family and discuss with your partner, and these problems can definitely be, you can overcome these problems with a little help and with a little counseling and with a few medicines. There is definitely, that could be the reason that your high sugar levels are not allowing you to ovulate, or there is no implantation because of this. And also, if your sugar levels are high, we need to see that you're not, the thyroid levels are normal, your sugar, you're not polycystic ovary. These are some of the things that need to be looked into as well, and accordingly, the treatment needs to be done. Thank you. Um, if your sugar levels are 150, just diet and exercise are not going to help you. You need medication, and after medication, we can look into your semen analysis and how the motility and the morphology is. If required, a DNA fragmentation index can be performed, that is a test, and based on that, we can have an adequate plan to improve the sperm quality for you. Absolutely, even not only with diabetes, pre-diabetes, even with diabetes, people can conceive a child. Um, it could be a little difficult for a few people, but even with high sugar levels, pregnancy is not something that is impossible. Diabetes affects fertility, as I have already told you, at the molecular level. It affects the oxidative, it causes oxidative stress, that is, the free radical generation is higher, which disrupts the mitochondrial function. It causes endoplasmic reticulum stress, and put together, all this causes a decrease in the quality of the sperm and the quality of the egg. All this is happening because of hyperglycemia, that is increased sugar levels in the body, along with insulin resistance. So type 1 and type 2 diabetes are pathologically, they cause the same problems. It is just that if it is type 1, sometimes you can even have problems in attaining menses. Type 2 can have irregular cycles. So both can have these problems. And in males, when it comes to males, again, it is the same thing. If it is type 1, which means that the diabetes has been diagnosed in right from childhood, so it means that there is insulin resistance. And in type 2, there is a problem with the receptor, and this type 2 diabetes is diagnosed later in adulthood. Typically, the symptoms may start earlier, but In type 1, the symptoms start earlier, but with adequate, effective treatment, we can have fertility even with type 1 or type 2 diabetes. Not essentially. If they are controlled, you have a very good chance of getting pregnant as much as any other normal individual. Thank you.